The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Dr. Yvonne Unruh from Western Michigan University, the Center for Fostering Success. Welcome to the Best Practice, Best Fit webinar series. Our mission at the Center for Fostering Success is to improve college graduation and career achievement rates among youth and young adults ages 12 to 25 years old who are aging out of the foster care system. We would like to acknowledge our funders, the Kresge Foundation, the Havermill Foundation, and WMU for making this webinar series possible. We're very excited to bring you this webinar in this series, which focuses on helping professionals, students, and supportive adults discovery-driven solutions related to educational attainment for students from foster care. Before we get started, I just want to mention that the study literature and a recording of this webinar will be available on our website following the broadcast. Also, if you have ideas or a study that you feel you would that fit our series, please contact us, and my contact information will be available to you at the end of the webinar. Today, we are more than pleased to welcome Chantel Crosby. She's a doctoral candidate at Wayne State University, and she will be presenting research entitled Trauma-Informed Teaching, Exploring the Perceptions of Court-Involved Youth. This study explores the impact of trauma on the educational well-being of court-involved students and provides information about youth perceptions of student behavior and school climate before and after introducing a trauma-focused teaching curriculum to the school personnel. So we thank Chantel for joining us, and now I'll turn it over to Carrie Ward, our graduate assistant and MSW intern here at the Center for Fostering Success, and she will introduce Chantel.
Chantel Crosby is a licensed clinical and macro social worker and a doctoral candidate at the School of Social Work at Wayne State University. She formerly worked as a mental health therapist in community mental health as a part of a juvenile justice mental health program providing home-based, outpatient, and school-based services. Throughout her doctoral program, she has worked in mixed methods research on the educational well-being of court-involved youth. She also served as staff of the Transition to Independence program, otherwise known as TIP, an organization designed to increase college access and retention rates of foster care youth at Wayne State University. She is co-founder of 5 Hope, a community service nonprofit organization with the mission of promoting service and civic engagement formulated to improve educational, behavioral health, and juvenile justice outcomes in the city of Detroit. Founded in 2011, 5 Hope has sponsored community health and behavioral health events and has provided ongoing tutoring and education services to local youth. Welcome, Chantel.
Well, good afternoon, everyone, and thank you for having me. I'm very excited to be participating in this series and sharing information on our topic today on trauma-informed teaching, exploring the perceptions of court-involved youth. The research presented today stems from a collaboration between Wayne State University research faculty and Claire B. Ford Academy, which is a second chance academy for female students. This particular school is located on the campus of Vista Maria, which is a child welfare agency in the Metro Detroit area. And the school principal, Beverly Baroni, has a tremendous investment in improving the quality of education for her students through trauma-informed teaching practices. So us at Wayne State have been sort of partnering with her and her school, conducting various forms of this type of research for the past 3 years, and this particular portion of the research has been published in a 2014 issue of Children and Youth Services Review. So we'll get started. Our objectives include a few things. I'll discuss the impact of trauma on the educational well-being of court-involved students. And when I say court-involved, I'm referencing those young people who have had interaction with the court system, either due to foster care, juvenile delinquency, or both. I'll also provide data from our study on youth perceptions of student behavior and school climate before and after we implemented our trauma-informed teaching intervention. And I'll also highlight the importance of trauma-informed practices in school settings as evidenced by our data. Then I'll provide some implications and strategies for working with court-involved students, such as those in foster care. Alrighty. So, as many of you may already know, youth in the foster care system come into this system with a history of traumatic experiences that oftentimes impede their development in a number of areas. This trauma may impact them emotionally or behaviorally. It might interfere with their social development and how they relate to others. It can hinder their physical growth and maturation, and also definitely impact their academic development. To provide some clarity on what we mean when we say trauma, our study views trauma as the inability of an individual to respond in a healthy way to acute or chronic stress. And when youth are exposed repeatedly or in an ongoing way to traumatic events, we define that as complex trauma. We know that this type of trauma, this complex trauma, is generally very commonly experienced by youth in the foster care system, which may be why we see rates of PTSD, post-traumatic stress disorder, at such higher percentages among this population. When compared to same age peers, youth in foster care experience PTSD at a 20% higher rate, and even more alarming is the fact that foster care youth demonstrate PTSD even higher than war veterans do. So we can really see that the impact of trauma and complex trauma in the lives of foster youth is really an extremely important issue to address. As I noted earlier, trauma can impact multiple aspects of a youth's development. But for the sake of this presentation, we'll be focusing on the impact of trauma on academic development and educational well-being. For anyone working with young people in a school setting, it really becomes clear that there are certain skills that make some students successful in comparison to others. We see in literature that it's been highlighted that concentration, memorization, the ability to organize, control, and self-regulate behaviors, all of those things are very important skills that are necessary to being successful academically. Unfortunately, the development of these very skills can be interrupted by childhood trauma, and traumatized youth often have difficulty communicating their thoughts and feelings effectively. They have problems forming strong relationships with others and maintaining appropriate boundaries in these relationships, and they can also have difficulty cognitively processing information. These factors can create some overwhelming academic challenges for foster youth. We see that youth with trauma backgrounds often do worse in school, score lower on achievement tests, and are less consistent with turning in their assignments. They often fail a grade at a higher rate than their peers, have lower grade point averages, receive disciplinary referrals more frequently, and overall they graduate from high school at lower rates than other students. All of this undoubtedly impacts the trajectory of their post-secondary life. If they're not graduating from high school, then they're not able to go on to college and obtain the type of credentials to be as professionally and financially stable as other young adults, which hinders their ability to be successful into adulthood. Because of the overwhelming impact of trauma on the educational well-being of traumatized and court-involved students, the school principal of Clara B. Ford, Dr. Baroni, really sought out a way to reshape the culture and climate of her school to better meet the more unique needs of these students. This plan to create a trauma-informed school culture included several different components. The first being administrative support. So this really means creating buy-in on the administrative level that trauma-informed education was at least important enough to explore as a method of improving the education of students. It also means creating an administrative structure that can support this new culture, which included having trauma-focused professional development that was built into the teacher's workday and the school staff's workday, as well as having additional paraprofessionals available to help cover classes and assist in the classroom. Another component of becoming trauma-informed was collaboration and support from school officials, which included the CEO of Vista Maria. Again, this is the child welfare agency where the school is housed. the school authorizers at Ferris State University, and the CEO of CES Partners, which is the school's management company. And building this new culture also required networking with people who are knowledgeable about trauma, including mental health professionals, trauma-informed school personnel, and researchers like ourselves at Wayne State. And then finally, this plan also meant hiring staff who were trained in mental health and trauma, so that in a sense we have individuals at every level, from administrative officials to the actual teachers and staff and paraprofessionals, really owning this effort to move into trauma-informed practice. So for our current study, we really wanted to focus on the perceptions and experiences of the students. Other literature has done a really good job of highlighting the perspectives of school staff who work with the students. However, the voice of the actual students is generally not included in these studies. And so we wanted to understand educational well-being from the students' perspectives. Our research aim was to explore what behaviors students perceive in the classroom from themselves or from other students. We also wanted to identify what childhood experiences they associate with these behaviors. So why do they think these behaviors are present? Then we wanted to also find out what things students think school staff can do to improve their learning environment and address the behaviors that they see taking place in school. So for our methods, we implemented a trauma-informed teaching intervention that was comprised of several different elements. First was the curriculum. The entire school staff participated in these sort of monthly trauma-focused professional development trainings on childhood trauma and trauma-informed practice. The curriculum for these trainings was an adapted version of a manual that's actually currently available online titled The Heart of Learning and Teaching, Compassion, Resiliency, and Academic Success. Our trauma-trained mental health professional infused this guide with some other theoretical concepts, things like ecological perspective, attachment theory, some other information and training activities to really create an individualized curriculum for this particular school. This also included an ongoing set of observations in the classroom and throughout the school with individual coaching with teachers and staff to help reinforce the principles learned in the trainings. Then there was also the creation of the Monarch Room, which is this school's alternative to traditional suspension practices. So when students become escalated in the class, they're either referred by their teacher or can self-refer themselves to the Monarch Room, where they interact with a trauma-trained mental health professional for a period of about 10 minutes or less, and then are sent back to the classroom. So really the goal of the Monarch Room is to give students brief de-escalation support so that they can re-enter the classroom and resume learning. And then finally, administrative debriefing is also a part of the intervention, and that occurs with all of the participants, including the trainers, the school staff, the researchers, the students, and this really allows everyone to understand the gaps and the challenges that are present in the process and to really kind of work through to some potential solutions for improving the intervention. So this is just a screenshot of the front cover of that guide that I referenced in the previous slide. A link to their website for this particular manual, I'll give that a little bit later in the resources portion of the presentation. So for our data collection, we conducted focus groups with the students, and we did that before and after the intervention. And in these focus groups, we asked students three main questions. What student behaviors do you guys observe in your school setting? What childhood experiences do you all feel may impact these behaviors? And what ways do you feel that teachers can improve the learning environment and other school staff? And so these focus groups were recorded and transcribed verbatim, and then we analyzed them for consistent themes that emerged. At the time of this study, which was between September 2012 and June 2013, 184 students were enrolled at Clarabie Ford. All of the students are female at this school and are all court involved with a history of abuse and or neglect, and so they've been subsequently placed at Vista Maria. Once released from Vista Maria, many of the girls do opt to continue attending school at Claire Before from the community. Also, about 90% of the youth residents have a mental health diagnosis, and the majority of the students are youth of color. Our sample consisted of about 39 of these students who were randomly selected to participate in the focus groups. And so here is just a breakdown of the demographics of our sample. Again, we had a total of 39 students participate in the focus groups. The majority were African American at 69%, with 23% being white and 8% being from other races. Also, here's the grade breakdown of the students who participated. You can see it was mostly even across grades, except for the larger percentage of students from the 10th grade at 46%. Here are our main findings, grouped into 7 different themes or categories of responses. For each of our focus group questions, the 2 most commonly reported themes are shown. And then we also have one sort of miscellaneous theme that also emerged from the focus groups, but was not directly related to one of the 3 questions. 7th theme. So for behaviors that students observed in the classroom, 38.5% reported that anger emotions was a commonly observed behavior. And then also 30.8% reported aggressive actions as being a commonly observed behavior. And so those were our top 2 themes that came out from that question. For causes of student behaviors, 33 1/3 attributed student behavior to environmental influences, and 23.1 said that triggers influence student behavior. And then for student suggestions for staff, 30.8% reported that staff should encourage mutual respect in the classroom. And 25.6% mentioned staff improving their management of student behavior as a suggestion. And then finally for our 7th theme, that miscellaneous theme, 15.4% reported that the Monarch Room was a school support for them. So now we can go through each theme in a bit more detail. For theme 1, which focused on the behaviors that students observed in the classroom, students identified that they have displayed or observed anger emotions in the classroom or on the school grounds. And these findings are sort of encapsulated in the following quotes. Like the kids, they come to school mad and it completely ruins your day because they take their anger out on you. And then we have a second quote for that theme. You already got the anger and the frustration and the stress and the pressure that builds up inside you. So you can kind of see these emotions are really described as frustration, irritability, stress, and pressure, and are common feelings that influence learning in the classroom. For theme 2, also about observed student behavior, students identified that they have displayed or observed aggressive actions in the classroom. One student said, it don't even depend on who the person is. It's just that the one person says something out the way, you automatically get mad and you want to just attack them. So some other aggressive actions reported in our findings included verbal fights, aggressive posturing, and demonstrating just a general inclination toward violence as a means to address interpersonal problems. And overall, students really reported having some pretty strong feelings about anger and aggressiveness in their classrooms, and that these emotions really impacted their ability to function and their readiness to learn. Our next themes 3 and 4, focus on causes of student behaviors. For theme 3, students reported that behaviors are caused by environmental influences outside and inside of the classroom. And so we have a quote to sort of illustrate both of those. One student referring to influences outside of the classroom said, hanging out with the wrong people, and they made it seem like it was okay to drop out and find a job instead of going to college and getting a career. They made it seem like it was okay to flip money. They made it seem like it was okay to sell drugs and stuff like that. Another student discussing influences inside of the classroom said, other people, students, have attitudes, and it kind of combines with your attitude because you're in the classroom full of kids that got attitudes, so it's even worse. It's like, well, I'm going to make my attitude more bigger than everybody else's, and then you start acting out in everything. So you can kind of see these sort of environmental influences that they described included their peers, included relatives or other community members who role modeled negative behaviors, and students were really aware of how these environmental influences, including their classmates, impacted their own behavior. For theme 4, students reported that their behavior was also caused by triggers. And triggers are often manifested by exposure to trauma and stress and have the potential to elicit some pretty strong emotional and physical responses from students, and therefore can impact their behavior in class. Some of the triggers identified by students included certain sights or sounds, words, physical touch, and other types of interactions. This theme was really very well encapsulated by the following quote. One student said, we were in social studies class one day and we were listening to songs to help us write a poem. And just listening to this one verse brought back everything. And I just put my head down on my desk and bawled my eyes out. So as you can see, students reported that triggers can also affect their ability to focus, complete work, and generally be productive in class. Now both theme 5 and 6 focus on suggestions that students are offering to staff to improve the school setting. For theme 5, students recommended that teaching personnel encourage respect for others. One student said, just treat the kids with respect, help them when they need help, and basically that's it. So very sort of clear and to the point, students reported that feeling disrespected evokes negative responses in students that can lead them to sort of reciprocate what they feel is disrespectful behavior. And students desire to feel respected by both peers and teaching personnel, and really suggested that the school environment uphold policies and standards that require respect for teachers, staff, and students alike. For theme 6, students recommended that school staff need to improve their management of student behavior. A lot of the students really viewed arguing, consistent talking in class, and other negative behaviors as a distraction to learning, and really encourage teachers to actively address those issues. One student said, I think it's more about just having consistency, because there's some kids that will try to bend the rules. Some of the teachers don't know how to handle that, or they don't want to handle it, or they just let the student do their own thing so the teacher can get through with class. So overall, students really indicated a desire for a productive learning environment with teachers who feel comfortable enough to address difficult behaviors that may threaten this atmosphere. And then for our final theme, theme 7, students recognized and appreciated other trauma-informed resources that were present in the school. They saw the Monarch Room as really being a support for them. One student said, if you're having troubles in class, or you just need somewhere to calm down, or someone to talk to, or you need somewhere you can use your coping skills, you can go there. There's a staff who sits in there, Miss X, and I talk to her frequently because I have a trust built up with her. You can just go in there, sit, remove yourself from the situation so you can think clearly without, the people in your face, or like feeling like you're crowded in. So when students are becoming too frustrated for whatever the reason to really remain in class, the students view the Monarch Room as a therapeutic option for handling their emotions in a safe and supportive environment, rather than a punitive or a punishment or a disciplinary sort of action like a traditional sort of suspension option or in-school suspension practice. So what are some of the implications for this research? Well, we see that student survival reactions, emotions, and triggers directly complicate learning for traumatized youth. And students are not always able to communicate these emotions while experiencing them, so they may communicate them through behavioral outbursts and class disruptions. So school staff should really then be well trained on psychological trauma as a part of their general professional development, as well as ways to effectively engage students rather than engaging in power struggles with students. Next, a trauma-informed training curriculum may really serve as a powerful tool for educators interested in closing the achievement gap between traumatized youth and their non-traumatized peers. Preparing and recruiting trauma-informed learning facilitators to implement training in schools should also be a high priority. And then also hiring administrators and staff who have mental health training that can also enhance this process. Some more implications: school staff should really aim to maintain safety, supportive connections, and management of emotions in the classroom, which is really critical to ensuring classroom success. We know that student behavior and school attachment are heavily influenced by positive relationships between students and teachers. We also know that the strong relationships between students and teachers helps to develop caring class environments and feelings of safety. Therefore, staff should really consider adopting attachment-driven interventions, trauma-informed interventions that can generally lead to better outcomes for students. And then finally, school suspension practices, which we find to be pretty generally counterproductive, should be sort of reconsidered for alternative trauma-sensitive methods to disciplining students. So some strategies for practice include utilizing trauma-focused professional development that emphasizes strong relationships between students and staff, with an emphasis on the vital role that staff can play as caring adults in the child's life. This training should also help staff to develop skills and share strategies among staff to help students regulate their emotions and gain social and academic competence. Staff should also have opportunities to identify and use outside resources and supports to help students to become successful and see value in their school. Some classroom-based strategies include emphasizing the creation of a safe learning environment, helping students to learn and develop social skills, self-awareness, and self-regulation so that they can better integrate into the classroom setting. And then also using various different academic teaching strategies to help students who may learn in different and non-traditional ways. And finally, some strategies for policies and procedures include reviewing your school or agency protocols to make sure that sensitivity to trauma is reflected in your discipline policies, your communication and compliance procedures, and also your collaborative sort of activities with other stakeholders in the community. And now here are some resources, some additional resources. I've included links to 2 major manualized texts on implementing trauma-informed practices in education settings. You can also feel free to contact me directly for more information on either of these texts or on any further information regarding the study. All of these are some really good resources, and the Heart of Learning and Teaching, the manual that we sort of adapted for our purposes, that's also included in here, a direct link to that text. And then here is that contact info. Again, feel free to contact me if you'd like any further resources or information. And now I'm open for questions.
Yes. So Chantel, thank you for that very wonderful and informative presentation. We have questions for you. The first one is, how has staff responded to the intervention? Has it helped them in their roles?
I would say that they've definitely taken very well to it. I think that with any sort of implementing any sort of new sort of culture, into any environment, there's going to be some difficulty, maybe a little bit of pushback. And I think some of the school staff initially were a little nervous about, how to go about implementing some of these new practices when they're already, so taxed in the classroom. But what we've seen is over time, and again, this is sort of the first phase or the year 1 of our study, and we're now in year 3, what we've seen over time is that some of these strategies for working with students have really made the teachers and the other school staff feel a lot more comfortable and a lot more, have given them more resources for dealing with some of these very difficult behaviors that they see in the classroom. And so over time, it's sort of shifted from maybe a little discomfort to having to implement something new to really feeling a lot more competent in their work. And so it's really prepared them, I think, to be better and more effective in their roles.
Next question. What advice would you give around getting, excuse me, what advice would you give around getting the necessary district policy support for folks trying to replicate this model on one campus or bring it to scale for several campuses?
It's a really good question. I would say, one thing that we have been doing is really trying to make sure that we have the evidence to support all of what we've been doing, and really making sure that even starting out with a small scale sort of evaluation, if you start to implement some of these trauma-informed practices into your school setting or your agency, and if you're in any way able to sort of evaluate, even on a smaller scale, how those practices have been impacting your students, then you have a little bit more leverage in terms of getting people in policy and getting people with funding even interested in the work that you're doing. So I would say that really trying to, at least initially, start to evaluate some of the really cool tools and resources that are out there, adapting them maybe to your sort of individual needs of your school or agency, and partnering with other people who can either assist you or can be a resource in evaluating that and getting that information out there to policymakers.
Thank you. Another question, how has student performance been affected by the overall intervention?
Another sort of component of this study that we've been looking at is looking at how, looking at that very question, how students are doing in the classroom, how it's affecting their trauma symptomology. And one thing that we have seen is that trauma symptoms have decreased over the course of our intervention period. And so while students, it's a tough population. It's a residential campus, and we do have students coming in from the community. We have been able to see some actual, quantitative benefit to implementing these strategies in the classroom. Another really big part of this is that students are not being suspended and expelled at the same rate, and so students are able to stay in the classroom, which automatically will, have some benefit to their learning. If they're not kicked out of school for 3 or 4 days at a time, they're going to the Monarch Room, spending a shorter period of time in the Monarch Room, and then going back to the classroom, they're able to continue in their learning. They're not missing out on assignments or missing out on the instructional time. And so that has also been a huge benefit in helping students to progress academically with this program.
Mm-hmm. Chantel, you showed in your slides that when you were identifying the main themes that it was roughly about a third, a little more or a little less of the participants who were sort of naming the particular theme that you were discussing. So I'm just curious about what were the other students saying, or what were the other thoughts that were being presented to help them describe their own behaviors in what they were seeing and the reasons for it?
Sure. We had quite a few different things, and a lot of them we would have the way that we sort of identified which themes were sort of the major findings, that 1/3 of the group was really sort of a much larger proportion when looking at some of our other themes, which might have maybe 1 or 2 or 3 students mentioning it. But they did come up with quite a few different things, and some of those things related specifically to student behaviors, in addition to the aggressive and the angry emotions. We've seen shutting down, which they described in a number of ways. We've seen other sort of emotional outbursts, which they described in a number of ways. We also saw bullying behaviors. So a lot of different behaviors. There were also some positive things. We did see, some students did identify that, in the classroom, students are trying to get work done, which, is obviously, it wasn't one that was really discussed more commonly. But I think the students are really able to understand and observe a lot more than we might give them credit for. But definitely those two themes, the anger and the aggressive emotions and actions, those were the ones that were sort of consistently discussed and discussed across the board by more than just a handful of the students.
Okay, thank you. Next question has to do with trauma-informed theory or trauma-informed interventions as a label. So young people who are coming out of the foster care system are carrying the burden of many labels and many challenges. And although trauma-informed interventions is so critical to understanding how to shift our response and our work with these young people, what do you say to that being another label around young people, sort of carrying this trauma-informed label?
I think that's a really good point to bring up. One thing that has really been emphasized in this program is that while we call it trauma-informed because it's such a departure from maybe the traditional or the norm in school settings, really the goal here is for this to become, the sort of standard practice in school settings, so that all students are really being given opportunities, and all students really have school staff educating them who are sensitive to the different issues that they face. And so I think definitely right now sort of the push for more trauma-informed practice in child serving systems, that's sort of what we call it, that's sort of our phrase for it. But definitely we don't want to get into a situation where certain types of schools or certain types of students in schools are being labeled or are having stigma attached to them because of those particular labels. But I think really sort of the overall goal, again, is to really have it not be trauma-informed education, but to eventually get to a point where that is, again, the sort of standard of education, that staff are knowledgeable about trauma and are able to identify things in their classroom and engage with students in ways that that can really prepare them better for the different circumstances that they face. So I think that's really sort of the goal here.
Next question is, have there been any changes to the intervention since this initial study?
Yes, actually this past year we started to sort of integrate some sensory integration material, looking at just some of the ways that different tools and resources can be used in the classrooms for students who might benefit from, having squishy balls or having other types of tools that have been seen to be useful with students who, or with young people who've experienced trauma. And so we're kind of educating the school staff now on sensory integration, on how touch and sound and the senses can all be impacted, like we talked about triggers and how that that is a huge issue in school settings for traumatized youth. how sensory integration can be used in the classrooms, and really having staff be knowledgeable about that and ways that they can use that to help students who are dealing with issues in the classroom as they come up.
Our next question is, so these young women, as the case is, were in residential treatment and residential schooling, correct?
Yeah, the majority of them were, yes.
Okay, so how does this intervention help them transition to less restrictive environments? So what is the thought about, what is the skills? Because the environment is being changed, but what will these young women carry with them into different environments that will help them?
Well, I think one of the things that first came to mind is the idea of this monarch room, sort of in traditional school settings. The idea of having any type of really strong emotional response or difficulty in the classroom can really be frowned upon. And one thing that I think this monarch room really emphasizes is the idea that, you know, there are times when people get angry, when people get upset, when people become sad, and that it's okay to experience those emotions, but that rather than being penalized for them, people need to have the opportunity to sort of process them and deal with them appropriately and effectively, and then sort of kind of find a way to get back into whatever their role is, whether it be a student or a teacher. That's just sort of a normal part of sort of development and learning how to interact. And I think that probably is one of the main things that we've heard thus far from students about being able to learn in school, not just the academic part, but to learn how to process those emotions, learning how to self-regulate. And school not just being about, you know, math and reading and social studies, but really also giving them opportunities to learn how to manage their emotions and then take that out into the real world.
Okay, very wonderful. I'm waiting just to see if there are any other questions from folks out there, but and while we wait for that, Chantel, is there any other thoughts that you want to share?
I would just say, you know, the resource slide had quite a few materials. I think there are lots of ways that, you know, this is just the way that our particular school has sort of conceptualized implementing trauma-informed practice. But there are a lot of ways that, you know, even if you may not have full administrative support, or you may not be able to implement all of these different strategies, there are definitely some resources that can give you some tips on ways that you can incorporate some different components of trauma-informed practice in school settings. And so I would just encourage everyone who is interested to just check out some of those resources and find out ways that this could be useful to the young people that they're serving.
Okay. So we do not have any other questions, and so that will wrap up our webinar for today. Chantel, this was absolutely wonderfully informative, and that you're giving focus to the lives of young people by allowing them to speak on their own behalf, sharing their experiences in the way that they perceive them in the world, and inform intervention and practice of professionals is just a really important line of inquiry. So thank you for sharing your research with us today. So thanks for participating. If there are other ideas out there for folks who have interest on presenting on a best practice, best fit webinar series presentation, if you have that information and you want to explore the possibility of being on a future webinar, then you can certainly contact me, and we will get you directed to the right place. Also, the supporting materials for this webinar, you will find them on fosteringsuccessmichigan.com website, and those will be available for you along with the audio recording of this presentation. So thank you all for participating today, and we wish you all well in supporting and serving young people as they age out of foster care and into higher education. Have a good day.